Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
And so it's a concern that, and I think as John Buchanan had mentioned before, his white doctor didn't even recommend a PSA or a digital record examination. I think for white people that may be okay, but with our history of prostate cancer, I think that's something that we need to really look at and rethink, and especially with the data demonstrating that prostate cancer is increasing in men. We talked about some of this last week. I thought this article reinforced the concern, particularly as it relates to black men. Any comments about this? Because one of the things that we talk about in many instances is that the research that they do often highlights white men and women, and this is a situation in which this may have a negative impact upon black men, especially if they're not going to get the PSAs and do the electric examination. Any comments on this subject, which is one of the three topics I want to talk about before we go through?
My question, Dr. Callender, is what about breast cancer? Is that going up or down?
It's going down.
In black women?
It's going down. It seems that for all of the cancers except for prostate cancer, it is decreasing. Although it seems to many of us that we have so many black women who are dying of breast cancer in the country. Okay, the second issue, since there's no time on that, is that one thing that we don't talk about much is the transient ischemic attacks called the mini stroke. And some people have these maybe 1 to 3 months before they have a major stroke. And sometimes people consider this as a mini stroke and don't consider it an emergency. But it's important to recognize that you have the signs or symptoms of a stroke, but they disappear. And you shouldn't forget about it. You should go to the hospital immediately and treat it as an emergency. So you can do studies to find out. Because it's clear that within 3 months, people who've had ischemic attacks have strokes. What are the signs of these ischemic attacks? The same as the signs of stroke. You have facial drooping, arm weakness, speech difficulty, dizziness, and so if you have any of these, temporary blindness, any of those kind of things that come and go, it's important for you to go to the emergency room and have it treated as though you had a stroke and to find out, because it's actually a prodrome or a preliminary what may turn out to be a stroke. Any comments about that before I go to the third part? This is particularly true in people who are over the age of 65. And if you have any of those signs or symptoms, then it's important to go to the emergency room immediately. The third thing is something that we talk about some, but you never talk too much about the way to avoid falls. Falls are common. 1 in 4 adults who are 65 and older fall each year and result in injuries such as rib fractures, hip fractures, or head injuries. And it's clear that balance training can help you prevent these falls. And so I think John Buchanan has talked about the role of yoga and Tai Chi, and there are fall protection programs for seniors all over the place, and it's advisable that if you're not doing any balance training, that you do balance training. They talk about Zumba as dancing as one of the simpler ways to uh, do balance training. They also talk about yoga and talk about Tai Chi, and they talk about balance building exercises 2 or 3 times a day. And they talk about does anybody have any interest in this topic of balance training that can prevent you from falling and breaking your hip, back?
One thing that I've done is my yoga instructor recommends balancing every day on one foot, and she says you could do it while you're waiting in line at the grocery store. you know, and she recommends like 20 seconds on each side, and the pose that we normally do is the crane, like in the
Karate Kid.
Yes, thank you very much. You read my mind. In the Karate Kid, the crane, but having the other leg up either below your knee or above your knee, not on your knee, and practice that on each side. So that kind of helps. I had a fall. I think I told you guys last year. I did something really stupid. So I've got a CPAP on and I have a mask on. The sleep mask shuts out the light waves, and it's like totally pitch black. So that helps. But I got up and went to the bathroom with the mask on, and I came back. I thought that it was the door to the bedroom, and it was the stairs.
Oh no!
I ended up falling down the stairs.
No.
So that's one of the things you can do to prevent falls is to prevent stupidity. Sorry about that. Anyway.
Thank you very much. Any other comments?
Luckily, I didn't break anything.
Dr. Callender, this is Sylvia. I normally try to tell my mom, who's 92 years old, to keep her cell phone on her. She is in a row home that has 17 steps from the basement and then another 17 steps from the living room to her bedroom. And I try to tell her, and she rides her bike, a little bike every morning, which is a good thing. But I try to tell her, keep your cell phone in your pocket or something so that, if something does happen, you can easily, contact somebody. But that's a hard thing to do. She still doesn't, is not that disciplined in doing that. But at least she's disciplined in riding her bike every morning.
What about those health alert badges that you see on television for people who fall and can't get up? Anybody have any thoughts about that?
Yeah, buy an Apple Watch. I have an Apple Watch, and it'll respond to any shock or loud noise, and it'll say, "Did you have a hard fall?" And if you don't respond, the watch, if it's connected to your phone, will call 911.
Oh, wow.
And there are different services that have monitors for seniors, and it's something you can wear around your neck and just push a button. You're right, seniors aren't going to necessarily put a phone in their pocket. They won't think like that, but they would think about the neck as being a necklace. However, I know a very good friend of mine, she cares for her senior aunt, and she bought the neck thing. She fell, and somehow it triggered something. And they were talking to her. Lil, are you okay? Lil, we're not hearing from you. Say something to us. So they ended up calling my girlfriend. She had to rush over there. Aunt Lil, why didn't you say anything? I ain't know those people. So she had to let her know, if you hear that voice, it's to help you. Oh, okay, I got it. But there are things you can do, especially with a senior. You got to kind of drill it in them. But and I don't know, the DC government has this type of service, and it's something you can wear on you, a necklace, and just push the button. So try to look into different services for seniors. Maybe she won't do that cell phone thing, but you got to let them know if they talk to you, answer.
Good topic for next week to talk about that health alert system, because you're right, the seniors who can fall down, who live alone,
Yeah.
down and be there for days without any help if they don't have some system.
And that same person fell down, couldn't get up. 2 days went by. Her daughter, who's supposed to been kind of looking out for her, was out of town, and they called her. They said, break the door down. And they did, and she had fallen. And they had to rush her to the hospital. And she was there for 2 days. So this is important.
There's a lot of good comedy around teaching seniors to recognize the name of their digital assistants, because you can say, hey Siri or hey Alexa, but if you say hey Alice or hey Stephanie, it doesn't work.
Yeah.
Yeah, I tried mine. It said I said, hey Darryl, and it didn't do anything.
That's because it was too cold in Chicago.
Well, good morning again, Dr. Callender. Two things. My Zumba exercise include exercise for balancing. And the second thing is my mother, we rotate her, who's 95. We rotate her, and she's in California right now. So we went to relieve my sisters about 3 months ago to give her a break. And so we were all in this big house, bed and bath together. And I told my younger sister, do not close her door. Whatever you do, don't close the door. Because when she lived with me, I wanted to hear. I hear things quickly, and so I kept insisting to my baby sister, do not close her door so we can hear everything. And so happened she listened that time, and my baby sister woke up, and my mother was on the floor because she had to go to the bathroom, and she didn't want to wet the bed, even though she had on protective clothing. She didn't want to wet the bed, and I heard my sister calling my name, and so I rushed, and I went and got my brother, and my brother just lifted her up, and then we just got to walk her so she can go to the bathroom. But yes.
Wow. Interesting. Okay, John, I guess you can hear more questions or comments. We can go on with the articles. Interesting that you would start off with that one. This is an article in the New York Times about a young lady who feared the organ donation system would kill her, and the writer is saying that it did. Actually, this is an interesting perspective, and I think with the different stories, you need to have a balance. The biggest problem in transplantation is the shortage of donors. And because of this shortage of donors, 20 people die every single day because of this shortage. So for people to overlook the real problem, the inefficiencies are true. Every system has some strengths and weaknesses. And this system has failings, and we'll talk about it. The fact that it's inequitable is well known. But the real big problem is that we don't have enough donors. And yes, this article talked about the many inefficiencies and aspects of it that need to be changed. And there's no question that it does need to be fixed. But we also need to put into perspective the fact that we have such a shortage of donors. We have more than 100,000 people waiting for organs, but we have only performed about 40,000 transplants. So when you do that, and you got 60,000 people waiting for transplants that don't come, then you need a perfect system, which we don't have. And so the allegations about inefficiencies are accurate. But I wanted us to put in perspective the fact that it's not only that you have a system that isn't perfect, but you have a shortage of donors that also compounds the problem. And it is true that all of these things they say are true, that things can be better. There are organs that do go to waste. And the wait for livers and lungs still is a problem, but not as much as for kidneys. Kidneys is the biggest problem. Lungs and livers, and that the difference is that for kidneys you have dialysis, whereas for lungs and livers you don't have a machine and you don't have a backup. So if you're waiting for a liver or lung, you can die. Of course, you can die waiting for kidneys, but waiting for lungs and livers is really big. Now, this is a problem that got much press. As you remember, we talked about the fact that the system, when they looked at the system last year, they pointed out some 14 failures in the system, and they proclaimed that the system is inequitable, and they have that is a fact, and they have identified some 14 factors that they're working on now to try to improve it. But until we get to the point where we have more organs, whether it be by xenotransplantation from other species or by growing organs themselves, this is still going to be a problem. Even if we had, even as we improve the system, you have to keep in mind that the donor shortage is the biggest problem of all. System failing is another problem, but both of them together are problematic. Any questions? Because I think this is a very important issue. Getting the system to be as good as it can be is critical. Also, not forgetting that we need to increase the number of organs that we obtain so that we can save people's lives.
I had a question, Dr. Callender. They mentioned something about going to another state for a transplant if one wasn't available. For some reason, I thought that the transplant list was a national list. So wherever the transplant was available, it would show up.
Well, it is true, and this is one of the inequities. If you see, most people who don't have a lot of resources can't move from state to state, but each state has a different length of waiting list because they have a different number of people on the waiting list. So if you go to a state that has a smaller waiting list, you get transplanted faster than you go to a state that has a long waiting list, like New York, for example. There's so many people in New York. The list is much longer than a place like Florida, which is smaller. And so, yes, but here's the inequity. The inequity is that you don't have funds to go to another state, and you don't do that. And therefore, that issue still remains an issue of inequity.
Can a patient increase?
I'm sorry.
If they can, be on a number of different lists. Darryl, you were.
Yeah, can a patient increase their chances by joining the list for several different hospitals?
Yes. Yes. But
Dr. Cal
they have to be in different locations. In other words, in Chicago, for example, then about 3 or 4 transplant centers. So you have to select one of them. But if it's another city or state, then that's different.
Dr. Callender, do you know if any of the transportation systems, like, the airlines or the rails provide any kind of discounts, like when somebody needs a transplant and they need to get to another state right away? Do you know if the airlines or the train stations work with you to give some kind of discounts to help people get there in terms of?
Because I know of no situation where somebody who's wanted to do that couldn't do it because of lack of funds. But I don't know of a system that particularly addresses that.
I see. Mm.
Any other questions about this very serious problem, which deserves all the attention it can get? But it should do both correct the system and also find ways to increase the number of donors as the donor shortage is critical.
Dr. Callender, I can't quite hear you clearly, but I was going to respond to Sylvia's question about getting assistance. You know, with my husband's second transplant, he had to have it in North Carolina. Well, he had it in North Carolina because at the time, I believe, Dr. Callender, that Howard wasn't doing liver transplants at the time. Our insurance company said that John Hopkins and GW didn't meet their requirements, and we had a choice: going to Mount Sinai or going in New York or going to Duke University in North Carolina. I chose Duke only because I felt that the travel back and forth would be closer or quicker, and to live there for a while would be less expensive. However, the insurance company gave us a stipend. And so on a weekly basis, I think I had to do, it's like the travel reimbursement, how much I spent, hotel, and eventually my apartment, meals, very efficient. And I didn't lose much money, and they were very responsive.
And although that's different in the sense that that's an insurance, you had a great insurance plan. And I think Sylvia is referring to those people who don't have that kind of insurance and you have transportation. They don't have funds to do that. But so far as I know, I don't know anybody who has not been able to go to another state. But those people who do that already have funds usually. And so the person who has the shortage of funds probably is still lacking. I don't know of anybody who's expressed that. But, anyway, it's an issue. I think the Stevensons have a great insurance, and that's wonderful.
Well, that's good information to know, even about the insurance policy, so, and the company. So thank you.
Okay, any other questions on this very vital subject? Okay, let's go to the next one. Now, this goes along with the shortage of donors. One of the number of things that are being done now, 3D printing of organs is something that we see in the future in which we will be able to have organs that we can create. Xenotransplantation, donation from other species. The pig is the animal that we're looking forward to. And also stem cells, having stem cells that, like the islet cells of the pancreas, that can allow you to have a pancreas transplant, or growing organs, growing a liver, growing a kidney. These are things that we're getting close to. 3D printing is something that also is a potential game changer, so that this will help us address the shortage of organs, especially they've already been able to create a 3D bladder, which is the children, but they have not yet been able to successfully develop 3D liver or kidney, because there's so many blood vessels that have to be identified. So that's in the works, but it's not yet something that we can add to our armamentarium. And we do use the 3D to help us identify how to do surgeries and how to make things easier for many things. And the next thing we have in mind is to get actually organs that we can print by a 3D system. It's something that we're working on, but it's not yet here. And I think there's many of these ways we could use to try to address the #1 problem in transplantation, which is the shortage of donors. I think we have to look forward to that. Any other questions about this? Because this is a subject that people are working out. The one thing we didn't discuss was the wastage of organs. One of the things that has happened over the last 2 years, last 5 years, is we have a system now in which we take organs out and put them on a machine, and we can repair some of the damages that have been done by other and decrease the number of organs that are wasted. We lose some organs because they're damaged in recovery or they're just damaged. And so one of the things we can do is put these organs on a machine and repair them or fix them up and then allow them to be transplanted. So organ wastage is one thing and organ recovery is another. And of course, the other issue is increasing the number of live donors, which is another issue.
Dr. Callender, I was thinking that having models of organs could help surgeons or students, develop skills in surgery without having to have a cadaver. I think I might be a doctor today if I didn't have to look at a cadaver.
Well, we now have that capacity. Right. We didn't before. We now have that capacity. Okay, next. This is an interesting article that we've actually talked about also, that we want to ease the ability for bisexual and gay men to donate with, of course, they will still do the test to make sure that they don't have the HIV virus, but they are easing restrictions. I don't know, John Buchanan, when you went to donate, did you see any evidence of this?
I haven't been since they talked about this, no, but when I go in, they have a screening process that's very detailed about your interactions with the same sex. So and that was on my screening as well. So I haven't been back since this came out.
Right, and this really hasn't. I haven't seen the questionnaire to see how it's different, or the blood test that they're doing to make sure that you don't have. Because the issue is to be sure that you don't give somebody an infection, whether it's HIV or anything else. And so this is what, as we know, Arthur Ashe died from a blood transfusion that contained the HIV virus. And so we're going to, it's going to be interesting to see what kind of questionnaire they develop and what steps they take to ensure that this cannot occur.
Dr. Callender, I have a question. Has it been proven that the incidence of HIV is more common under bisexual men and women and gay men?
Well known. It is well known, yes.
The incidence is higher. I got
It is well known, yes. It is well known. That's true. Yeah. Okay, any other questions on this subject? Not. this is a new development that is shared. As actually, this is occurred in other countries, and this special, this is development that actually are left with permanent vision loss because of the bacterial infection associated with artificial tears. And people that have dry eyes have to have artificial tears. And in this situation, this Pseudomonas is a bacterium that's resistant to many antibiotics. And this caused eye infection with blinded person. And so it's cause for concern. There actually is cough medicine. I don't know if that article, I think it is. But anyway, yeah, so that we have to be careful about everything. You think you'd be safe with the dry, putting any kind of eye drop, but in this situation, there were Pseudomonas found in the bottles and the Pseudomonas caused patients to go blind. So take note of this. Any of you have dry eye? You do, huh?
I do. Yeah, I have to take artificial tears every day, at least twice a day.
Yeah. So it's important to be drug and germ free. And this has been until now. Yes, Elizabeth.
Yes, Dr. Callender, in the summertime, I usually get dry eyes. And I don't know whether we discussed it or I read an article, but
We lost your sound, Elizabeth.
I think we lost Elizabeth.
Yeah.
You lost the sound, Elizabeth.
Any other comment until Elizabeth comes back?
oh, I'm through.
Well, we didn't hear you at all.
Huh?
We did not hear you at all.
Oh, okay. Can you hear me?
We can hear you now.
Oh, okay. What I said, Dr. Callender, was that I don't know whether we discussed an article or I read an article, but I had dry eyes, and especially in the summertime, because I work out in the yard, etc. And I also have ceiling fans in my house. And so it talked about ceiling fans cause when you sleep cause dry eyes, right? So I stopped, I cut off the ceiling fan in the bedroom. And I haven't had dry eyes since, summer or winter.
What did you cut off?
The ceiling fan.
Oh, really? Ceiling fan. Wow.
Yeah, I don't know whether we discussed it in an article or I read an article.
That's interesting. No, I wasn't aware of that. Ceiling fan. How about that? That's interesting. Yeah. And ever since then, no more dry eye, huh?
Yes, sir. No more dry eyes.
How about that? Well, keep that in mind. Okay. It's interesting. We had an article recently about how gardening and shopping and other things like that, the exercise that goes along with that can improve your health. And it's interesting that they are finding that people participating in gardening programs eat more fiber, get more food activity, and therefore their health is better. And I guess it's been well known for some time, though, that gardening is a healthy exercise. And so those of you who garden, many of you garden?
I don't garden, but my husband does during the summertime. And he's grown some butternut squash and greens, and they were delicious. But Dr. Cal, I thought I heard somewhere where the government was trying to regulate those who are actually having these gardens. I'm sure it's a money issue, but somewhere I read that where they were trying to put more regulations on those who grow their own food.
I haven't seen anything on that. But
Well, I'm sorry.
go ahead, Elizabeth.
I garden and I also work in my flower beds. And I just plant enough for my husband and I. But you know, tomatoes love water, so they grow in abundance, and I share that with my neighbors and all my kids. But I also have to share my garden with the rabbits and the squirrels and other species that wants free vegetables.
Yeah, that's right.
Sylvia, I think that government intervention that you're talking about is because of people growing marijuana.
May well be. Yeah. Anyway, if we come across any articles, we'll share it. Next article. Well, we've talked about this ad nauseum, but they chose to do another article to point out that Americans aren't exercising enough. The figures of the need for exercise is so scanty. I mean, you're only talking about 150 hours, 150 minutes a week. So if we did 20 minutes a day or 30 minutes, 5 days a week, but yet only 16% of people met benchmarks. This is hard to believe, but it's repeatedly being demonstrated that people are not meeting the minimum exercise requirements. And as we talk about mental health and physical health, all of this is based upon us having this minimum exercise requirement, which we're not meeting. And and then we've mentioned previously that once you get past the age of 40, exercise is mandatory. And the question is, what else can we do to get people to exercise? And we talked last week about the many monitoring devices and steps and all that. Any other thoughts? We keep bringing the subject up because it's such an important part of our healthy lifestyle, in addition to nutrition.
That comment about people living in the South, less physically active. I was running in Mississippi a few years ago, and it was on a back road. And I planned to do a 5-mile run from Anguilla to Rolling Fork, Mississippi. And as I'm running down the road, a pickup truck with a gun rack stops, rolls down the window, and says, "You need a ride?"
Yeah.
Because they had never seen anybody running or jogging before, and they thought they knew I was going to Rolling Fork because it was in that direction as the only thing that was there, and they figured I needed a ride.
Darryl, what is Rolling Fork near?
Rolling Fork is 63 and a half miles south of Anguilla. I'm sorry, 63 and a half miles south of Greenville.
Okay.
Greenville's in the Delta, right by the river.
Yeah, I'm familiar with that whole area. Okay.
All right.
Now I know where it is. Okay, thanks.
Mm-hmm.
Is there anybody who doesn't exercise? 50 minutes a week? Good, that's good to know. So everybody's exercising. That's an article talks about 6 healthy links to slowing down memory decline. You know, we talked incessantly about how dementias and other things are increasing. And so trying to protect older adults against memory decline. And so not surprisingly, healthy diet emerges the strongest deterrent, followed by cognitive activity and physical exercise. And I think John Tatum talks about the cognitive activity that he got involved in. You want to tell us about some of the things you do, John? Keep your brain working.
You talking to me, Doc?
John Tatum.
Oh, John Tatum. Okay.
He's talked to us times about it. John, you gonna join us? John Tatum?
John, you're muted.
Okay, thank you for telling me I was muted. Yeah, I'm here. I didn't hear the question, Dr. Callender.
The question is, what are the mental gymnastics that you go through to keep your brain active? They talk about
Yeah, I started back with chess.
chess. Anything else?
At my physical therapy, they have a memory exercise that they give me. You know, memorizing three words in a row, and then 4 words in a row, and then, you know, by the pictures. So those are the things that I do.
Anybody else do mental cognitive exercise?
And John likes to read Parliamentary Procedure, Robert's Rules of Order from cover to cover.
Which is boring to anybody else.
I do a couple of games. I play one game called Wordle, but you have to figure out a 5-letter word. And another mental gymnastics is Sudoku or Sudoku. That's pretty challenging as well, especially at the expert and advanced levels.
What about puzzles?
Well, Sudoku's like a puzzle.
Okay.
Yes. Dr. Callender, I belongs to a senior wellness center book club, and I also belongs to 3 Bible study.
Yeah, no, good. And this is the last.
I like to sight read music, especially classical music, every once in a while, just to sharpen up sight reading and reading music and playing.
And I like puzzling and word searches.
Okay. Anybody else? No, keep those 6 signs. No, we can't go back to the 6 yet. 6 modifiable exercise, eliminating smoking, eliminating drinking. There's some recent data that's identifying alcohol as one of the 3 carcinogens that we should be staying away from, those who drink alcohol. Diet, of course, Darryl has talked to us incessantly about the importance of fruits and vegetables in eliminating meat and dairy products. But cognitive activity, then there's no minimizing or maximizing the importance of social contact. I think of all of these, I think all 6 of these are important. I wouldn't take any one over the other because they're all impact. And I don't think you do without any of them. Any other comments or thoughts about this? Because and this is interesting to show how many people actually do all 6 of them, and how many do. And the majority do 2 to 3.
Dr. Callender, what about just talking on the phone for about an hour or 2?
That's social interaction.
So, yeah.
2 hours is kind of long, but yeah. But that's social interaction. Yeah.
Dr. Callender, I participate in a lot of meetings. You know, as for instance, today, I count this group session as a meeting, and then Dr. Atto and I have another meeting.
Don't go
By
back
Zoom.
up. I want you to go back up to that. Yeah, I wanted to share that. Go ahead. Yeah, I think that's social interactions are very important. I think John would, I think Darryl would agree that healthy diet may have the strongest protective effect on memory. And that's an interesting aspect. That felt that that was more important than anything else, although all of these were effective.
You know, they say alcohol kills brain cells, and I believe that's really true. People that I know that are regular drinkers have the worst memories.
Yeah.
Is that while they're drinking or when they're not drinking?
Both.
Interesting question. Okay. Well, I think this is good for us to know and keep in mind as we adopt our healthy lifestyle. That does pay off in the long run. Go to the next one. Then. Any comments, additional comments about this? I included this one because I wanted to look at the signs of dementia. Jack Nicholson hasn't been seen in a while, and that may or may not mean that he's having dementia. And just because you don't interact with others doesn't mean you have dementia, although it's one of the signs. And as you go down the list, you see that it wasn't so much that I wanted to talk about Jack Nicholson. We keep going on down, and you see that what are the real signs of dementia? Keep going down. Sign. That's what I wanted to point out. And these are the ones that you look. Problems with attention and communication, difficulty in judgment, reasoning, and problem solving, diminished visual perception, referring to familiar unusual words, forgetting the names of family members and friends, inability to complete tasks independently, getting lost. Now, one thing it doesn't mention is something that Darryl has mentioned before, is the hearing and the link of hearing, the lack ability to hear with dementia. And the importance if you have hearing deficit to get a hearing aid so that you can hear, because that is also associated with dementia.
Dr. Callender, I have a question on that list. It says remembering the names of family members or friends. Now, I can remember family members, but sometimes I'm weak on remembering friends that I haven't been around recently. And I think that if you forget the names of family members, that's worse than remembering the names of friends.
When you see for example. Well, you know, one of the things about seeing the doctor right away about it is that we don't have good treatment for dementia. And it would be better if we had better treatments for dementia. And that's an area that we failed in. Although there's a lot of research going on, most of the medications that we use for dementia are not found to statistically significantly improve the mental deterioration. And so some wonder what's the value of finding out early that you get Alzheimer's. Well, one of the advantages is that people can help you. So it's not so much that you get medication to help, but you get help from people. So they can keep you from getting lost and other things like that. So right now we have a lot of medications for dementia, but I'm not sure that many of these medications really accomplish very much. And if there's anybody who's got evidence to the contrary, speak up, please. Now there's hope that down the road we will have medications that will make a difference.
I'm reading something from National Institute on Aging, that says high and low blood pressure levels among different older age groups were associated with varying dementia risks. It observed that high systolic blood pressure in people more than 60 years old decreases the risk of dementia, but both lower and higher blood pressure associated with decreased dementia risk in people older than 75. Seems to be a little confusing.
That's interesting, you're right, and I think the whole issue of what helps and what doesn't help is still being worked out. That's another way to put it. Do you have, I think most of us are associated with people who have different forms of dementia. Some very profound and some relatively minimal. Any of you not have association with people who have dementia? So virtually all of us. This is an article that sparked a lot of outcry from patient advocates. We mentioned it earlier because this particularly involves Black men, and a lot of it emanates from the information that the American Neurological Society put out about 5 years ago, which suggested that getting PSAs and video rectal was an overkill, and that you didn't need it, and so forth. That may be true for members of the white population, but especially Black men, this is backfired. And it's the one cancer for which is increased by 4 to 5% annually. So this is scary, and especially for Black men. And it's hard to find a Black man who doesn't have some prostate problem over the age of 85. Whether it's benign prostatic hypertrophy or prostate cancer. The question is, what should we do about it, or is there anything else that we think is important for our Black men? I think Black doctors know that this is a situation, but I'm not sure that white doctors are aware of this fact. And so it's important to educate all ethnic health providers about this. And this they were recommended against PSA screening. That was about 5 years ago. So we're seeing the results of this today.
Dr. Callender, what exactly is the early prostrate test like? What do they do?
Blood test.
Blood.
One is a blood test. PSA is a blood test. A digital rectal examination is another test. Those are the two tests that allow you to make an earlier diagnosis of prostate cancer. But the PSA is just a simple blood test. The digital rectal exam, put a finger in your rectum and feel your prostate and see if it's enlarged. Or if it's hard, and see if it's hard, then you may have cancer. Those are two simple tests that make the diagnosis for prostate cancer.
Dr. Callender, if you don't have a medical doctor or you do not have health insurance, what's another alternative for a man to try to get those tests, the testing done to find out their PSA level?
Unity is a group that takes care of patients who don't have health insurance, and that's the Unity Clinic is one. And if you're in DC, it's pretty hard not to qualify for Medicaid. And so all you have to do is apply for it, and you're virtually sure of getting it. And that will give you the insurance. But Unity Health Clinic is a clinic you can go to. It doesn't require you to have insurance. But if you live in DC, it's easy to get DC Medicaid.
Hmm. Thank you.
Yeah, this is a good article that talks about something that we have talked about before, which is the examination of the breast. And dense breasts are more likely to be difficult to diagnose with a mammogram. And so, as we mentioned earlier, that the government had indicated that if you have dense breasts, there are special mammograms that you need to have, ultrasound that you need to have, that make the diagnosis of breast cancer easier to come by. Whereas dense breasts increase the risk of breast cancer. They also increase the likelihood of your breast cancer being missed. And so FDA has proposed a rule that requires that they receive information on their breast cancer. That is a very important new development. And so I think all women should be aware of that. And they may not know it because the rule is published. And so it's a relatively new thing. So you have a dense breast, which means the mammogram may not pick it up from you. And a special ultrasound or other X-ray specifically for the dense breast. Women still getting mammograms once a year, every 2 years. I think it's something that should continue. While female genital cancer is still a problem, and you still need to have it. The mammogram is something you don't need. Pap smears for many people. If you have had the virus test, you don't have the virus, but you still need to have that. But for the mammogram, we still feel that breast ultrasounds or breast MRIs, along with the mammogram, are important, particularly if you have dense breast. And breast cancer is still a concern. And the question about whether we're having more women that now have breast cancer, we still have women who are dying from breast cancer. And so as long as that's the case, there's still much more we can do about it. Screening for women with breast cancer, especially those with dense breasts. This goes to the cost. And so whether the insurance covers it or not becomes an issue. Any questions about this subject, which is very near and dear to our hearts, because we lose so many women from breast cancer every year, and they're often are pretty young, being under 30 and under 40. No surprise, but this that race plays a role in emergency department It's interesting that a lot of it is related to whether or not to have insurance, in spite of the fact that you don't need insurance to go to the emergency room, because the law is if somebody has an urgent issue, they have to be taken care of, regardless of whether they have the ability to take care of it. So you would think that you wouldn't have any different outcomes in the ED, but the studies have demonstrated once again that worse outcomes exist for people with cotton black face. Why is it so hard to get rid of racism? Because of man's inhumanity, man in general, I guess. This is true. We looked at that in surgery and found that this is the case in surgical issues as well. And some of it relates to the social determinants of health. What you bring into the table when you come in plays a role. And look at that. They're more likely in the right place to be lower likelihood of getting to the hospital.
Dr. Callender, what is the ED?
Emergency department.
Emergency department, you said?
Emergency room, emergency department.
Okay.
And that's a place where theoretically, since you don't require insurance to go to the emergency department, you would think you wouldn't have it, but you do. And of course, this is institutionalized racism is something that is worldwide. Black people were thought to be subhuman, and in some areas they still are thought to be subhuman. So as long as we're going to look different, people are going to treat us different. And so we have to fight back to be sure that we're taking care of properly. This is something, I was reading an article about research that's being done on children from 0 to 5, because that's the age in which they need to be taught how to protect themselves against racism. And very often, we may not be doing enough to our children between the age of 0 to 5 to help them to be sensitive to the inequities that they're going to face because of their complexion. And so this is something else that we can do. And I'd like to hear the teachers, and there are many who are in the audience, who any comments about this concept that 0 to 5 is the age we need to address racism. Don't be silent, all you teachers. I know you're out there. I'll call you by name if you don't answer. Yes, Carol. Carol, any comment?
Not at the time. I invoked the 5th.
Why? You're a teacher. Why?
No, I'm just joking. That's what Trump did.
Well,
Dr. Callender, how does urgent care compare with the emergency departments?
that's an interesting question. But the difference is that for urgent care, you probably need insurance, but emergency care you don't need. I don't know if the study has been done on urgent care. That'd be good to see. Although you kind of rule out the person who doesn't have insurance or the price to pay for urgent care. But it's a study worthwhile doing. And I haven't seen the results of that study. John Tatum, what about you? What do you think about the and John Buchanan, great teacher. You're a great teacher. You're silent on this.
To be honest, Dr. Callen, I can't hear you too well. And so I never hear the question that you're proposing.
The question that I posed is over 5 too late to begin teaching our children about protecting themselves from racism?
No, I think you can go as low as you can go, because the grandparents, I mean, we have a family dinner every Monday, and we sit around and talk about issues. And one of the issues that came up is how much you should prepare your kids for racism. And as soon as they can understand it, and as soon as they get into a social environment that is challenging to them, I think that's the time to start talking about racism. We have grandchildren in college, and they've already experienced Williams. And so we're glad that we talked to them about racism before they went to college.
Well,
We talked about overt racism and covert racism.
what about the ages I'm talking about? Do you talk to them when they're 2, 3, 4, and 5? Or
I would say around elementary school, around grade 4, second half of elementary school, 4, 5, and 6th grade.
Well, the psychiatrists say that it's too late, that you should start between the ages of 0 and 5, because they are available and they are eligible and their brains can take it. And they suggest that after 5 may be a little late, but anyway, it's food for thought. I was reading an article that talked about starting this in kids from the age of 0 to 5, because they felt that after 5 is, you're right, the earlier the better, but they're suggesting that it should be between 0 and 5.
Anybody seen that video of Dave Chappelle, who he pretended to be a blind member of the KKK? And when he he didn't know he was Black. And so when he took his hood off at one of the meetings, everybody wanted to kill him.
Yeah. Okay. Any other comment about the age of 0 to 5 to begin teaching our kids about being prepared for racism?
Yeah, I have 2 boys. 18 just started first year of college, and then my 14-year-old. So we would talk about different issues, throughout the years. But my 14-year-old, he was walking to school this year. And I think this is the first time, even though we've talked to him about it, he realized that he was a Black male walking down the street, because he said a white lady and her daughter came walking down the street, and then the lady grabbed her daughter and moved to the side. So he was perplexed. Well, why would she do a thing like that? And I told him, I said, this is the way life is, unfortunately, right now, because like so many bad things are happening throughout the city, throughout the country. Sometimes you will be stereotyped, unfortunately. Even though you're going to school, you're on honor roll, you're doing everything you need to do. Not everybody going to see you for the wonderful person that you are. So again, regardless, I think we try to prepare the children, but when they actually face certain things, it's still very unexpected to them as well.
So what?
I at last, okay, I'll say something.
About time.
I think that when children, it's according what culture you're in and where you're raising your children. If you're raising them in DC, where it used to be predominantly Black, but it's changing. Yeah, I instead of grandchildren that are raised in Colombia, where those children are integrated and they play with each other and not recognizing that racial disparity. Where you're in an environment where they're recognizing. Now, the two children that are raised that were biracial and looked white, they were beat down by looking white. And the Black culture beat them down. So it was something that we talked about, racism, that Blacks were against it. I taught also in a setting in Southwest where anybody that was light-skinned or tried to attend the school where there were a lot of kids that were on welfare, they would literally beat the kids on the playground during lunchtime where they thought were light-skinned or maybe well off. Racism is according what environment that you're in and what the child has to confront with. I, of course, think that you should teach your children, especially if they're going to a whole new different environment in education. But you can only speak of what happened to you. That what's happening to them could be altogether different. But how you address it, when our grandsons drive a car, you always tell them, be respectful. And we told our sons growing up, which they came across, driving while Black, always being pulled over, have no more than two in the car together, make sure it's our car, know where the registration, those things. But to teach a 6-year-old or a 5-year-old that way, they tend to take things literally. And I don't see what the point of it is teaching a 3, 4, and 5-year-old about racism when they haven't been confronted about it. I don't understand what it means.
Okay, well, kids are confronted about it as soon as they understand language. And what I mean by that is they get taught by media. If it's TV, movies, radio, streaming, they get taught and they get delivered a lot of misinformation that you can't start early enough to counter. Some of the more popular misinformation that children get these days is that everybody's individuality, the cult of individuality, do your own thing. You're not part of a group, you're an individual. And so, you know, a lot of our Generation X or whatever, they're operating under this misguided principle of individuality, only to find out as soon as they reach adulthood that they're perceived as part of a group, not of an individual. Um, and, you know, if some more misinformation, you know, the perception is that people of color are a minority in this world. We're only a minority in this country, not a minority in this world. People, melanated people are way more than half the population of the planet. But they get a lot of misinformation. You know, if you just teach kids, yeah, it's dangerous to be Black in America. And so you have to have some awareness. And so you get your eyes open that you're not caught unawares and put yourself in a dangerous predicament. But it's got to be taught a whole lot more than fear, because if you're not taught any pride, then you kill your self-esteem, and that's a recipe for failure. You can't progress in life without a high degree of both self-esteem and group esteem. Got to be proud of Black people too, but you know, Blacks are getting taught not well. We've been taught forever not to be proud of being part of the Black group, and so yeah, there's I sincerely believe that you can't start early enough in teaching children about this world, because knowledge is power.
And I think that's why the psychiatrists have begun this study to look into that. It's very interesting to see what they find. I pretty much agree that the earlier the better, and I think we have failed in many instances in not teaching them earlier about what to expect in society. Okay, we're gonna move on to the next one. I thought it was food for thought and challenging to talk about a topic like this. This is a horrifying story about contaminated cough syrup that killed 300 children. That's hard to believe. It didn't occur in this continent, but it occurred in Asia and Africa. And it's frightening, horrifying. But the regulation of baby cough syrup certainly is something that is, and the products that they have are toxic products anyway. So, and you wonder who regulated the drugs in Asia and Africa. But anyway, this is what is happening.
Mute. There you go.
It's kind of important for us to be sure that our FDA does its job and keeps products like this from entering the market. You know, it's important that they are allowed to recognize that they have to ensure that this doesn't occur in the United States. Okay, let's go to the next one. That's interesting observation that COVID may increase the cholesterol level. We talked about the cholesterol levels and the HDL and the LDLs. That the HDL is the protective cholesterol, and the LDL is the dangerous cholesterol. And the higher the HDL is, the better off you are. And the lower the LDL, the better off you are. And so, with this in mind, they found that people who had prior COVID infection had increased cholesterol levels, and they wondered whether these were the good cholesterol or the bad cholesterol. And so the studies have been ongoing to try to identify. Because if you've got a low level of HDL, that's thought by some to be as bad as having a high level of LDL. Now, it's going to be a while before we can really get the answer to this question, but right now, there does seem to be a high cholesterol level. Whether it's meaningful or not is the question. So additional studies will have to be done before we really know. And since we've had 100 million COVID cases, and we've had more than 1 million people die from COVID, I don't think we'll be able to answer that question shortly. Next one, please. This is the latest variant is XBB.1.5. Tests have shown that the boosters were effective in 51 of the cases in protecting us against the latest variants. Time will tell whether that's going to be the case, but as of now, but essentially only 15% of people have received an updated booster. It's kind of sad that as a country we haven't done any better than that. And of course, as we go to events, more and more we find that fewer people are masked, and now we're learning that fewer people have boosters. it's interesting that the flu season has not been as bad as we thought it would be, and the flu shots actually are more effective this year than before, but I'm not sure why it is that we don't have any more flu than we had last year. Okay, let's go to the next one. This was an interesting article on Tony Fauci as he's leaving office. Talked about his thoughts about what he's done at the National Institutes of Health for 54 years. And the Institute of Allergy, NAIAD for 38 years. And we talked about his history and how he's had the opportunity to deal with many things, including, especially, to go with HIV. But the other viruses he's dealt with. And now he's going to share his information about his career. And he also is share about the impact he's had on this, and was continuing his role as an infectious disease expert. This has always been that. He talks about, I think the role he played with HIV is one of the highs, and I think the role he played with COVID was particularly good. Though there are many critics on his handling it. HIV was particularly great. Was at a time when HIV, everybody was afraid of it. It's interesting that the vaccine for malaria we talked about last week is still being studied, but that would be a major breakthrough as well. As he says, as many of you have said, the variants of viruses are ever present, and what's going to happen tomorrow is not known. So, and of course, we know about the annual COVID vaccine, which is something that I think is going to be a reality and something that we've predicted for some time. What I'm interested is how is the new process, the mRNA vaccine, going to help with the other vaccines, which is something that I think is a positive change. The time will tell. Now, this is an interesting question. Who wears a mask on the plane? Yeah. Yeah. Okay, I guess. Any other comments about Tony Fauci and the job he's done so far? What his future will be like? If not, let's go to the next one.
That's it, Dr. Kelly.
Okay, all right.